So if you're joining us today, Nicole and I are going to go through the records of the buyout horses from this group that we went through the last 2 days. This was an extremely heartbreakingly bad shape group of horses. So if you're watching this and you don't like to be depressed, you might not want to watch. We still have 8 of the 22 horses we received. 7. Thank you. So we had to make a lot of hard calls. And the purpose of these videos is for us to go through and just report our physical exam findings, what we saw in x-rays, what we saw in blood work, and kind of give you briefly the thought process that went into decision making, because it's a lot. The individual we got these horses from generally brings us horses in really atrocious condition. But in this case, this wasn't even a scheduled buyout. He sent photos, and the photos were so severe that our organization's leadership said, we're not waiting. We're going to get these horses here so we can provide them with the relief and the care that they need. So we're just going to go back and forth. You want to start?
Sure.
Oh, one other really quick thing. All of these animals get named. We know that it's very impersonal that we're reporting them as B numbers. We just don't have their names yet because our supporters name them. They vote on names. So when we're going through B numbers, we're not trying to be impersonal. We just don't know their names yet. And then other thing, sometimes we forget to write down that we gave pain meds or say that we gave pain meds. Everything that is painful in any capacity gets pain medication. So if we don't say it, but we talk about how painful an animal was, we promise we gave it pain meds.
Yep. So the first one we looked at was B25-185. This was a little 12-year-old donkey mare. She was gray, and she was probably one of the worst ones we had. Her front feet were just completely bent over to where she was basically walking on her coronet band. So like her hoofs were basically back here instead of underneath her. So we got her in right away, put her on a bunch of shavings so she was comfortable, gave her pain meds. She just kind of had a painful look in her face, and just overall was just a disaster. We did not put her through radiographs while she was still with us. We provided her with the last act of kindness pretty quickly because of how painful she was. And then we took x-rays afterwards, which you didn't even have to take the x-rays to know how bad it was. But they were pretty crazy looking x-rays because like everything was just kind of backwards.
Years of walking around in pain every step.
So yeah, she was provided the last act of kindness.
B25-186 was a 13-year-old Tennessee walking horse mare. She did have a cut tail tendon. So if you followed Horse Plus videos, there's a Tennessee walking horse show organization called the Big Lick that condones cutting the tendons in a horse's tail so they can flop their tails way up and make them look like they're kind of flagged. In my opinion, that practice is unethical. It's illegally practicing veterinary medicine. But anyway, so it's kind of easy for us to tell if a horse came out of that industry because they're the only group cutting those tail tendons. It poses no benefit to the horse. In fact, in some cases, it can damage the tail to the point that the tail can't work. And you literally can take the tail and you can flip it up back over the horse. Her body condition score was a 3 out of 9. So she was very thin. Her heart rate was in the upper 70s when she came in. Heart rate is one of our best indicators of pain. So, our little donkey's heart rate was 72. This mare was in the 70s. Upper end of normal for a horse is in the upper 20s. And obviously with exercise, it can come up a little bit. I gave her intravenous pain medication, and 30 minutes later, her heart rate had only come down to 67, and it was staying in the 60s. So this was an individual who did not respond well to our pain medications. She had increased GI sounds in all of her quadrants. So the sounds of her GI tract were moving too rapidly. And maybe that was related to how thin she was. Sometimes that can cause chronic diarrhea. I didn't document diarrhea because I didn't see this mare defecate. She had scars and wounds over her elbows and hips, and some hygromas on her elbows. That's an indication of that an animal's been laying down a lot. on hard surfaces. She had overgrown hooves, digital pulses in both her front feet. If you've ever slammed your thumb in a car door and felt it just kind of like boom, boom, that feeling, the hoof is a rigid structure, and when you have inflammation in the hoof, you can have a bounding pulse that's related to that inflammation. So a normal, healthy horse, if you put your hands on the back of their front feet, you don't feel any pulse. There's just, if you were assessing for CPR, you'd be like, the animal is dead, right? So it's abnormal to feel any pulse. This mare had very strong pulses. She also had pain on palpation of her withers, and when her back was palpated in the region of her pelvis, she actually fell to the side repeatedly. So that was an abnormal response. We took radiographs of her front feet that showed severe rotation in both left. I think we only took the left on her. Mm-hmm. Again, we apologize. I like to do these debriefing videos while the patient is fresh in my mind. Otherwise, I forget some of the details. But that means our team hasn't had time to sit down and relook at those radiographs. Mm-hmm. So I'm giving you from memory. I think we actually only took one front foot, and the rotation was so severe and the pathology was present in both feet that we made the call. She also had arthritis in her back. She had a fracture in her withers, and she had osteoarthritis in her hocks as well. This mare was only 13 years old, like should have been in her prime, and had end-stage untreatable disease. And she was given the last act of kindness.
B25 187, a quarter horse mare who's 25. She was extremely emaciated. We gave her a BCS of only about 1 to 2. She was down on the trailer and bleeding from her mouth. We were able to get her back up, but she was very unsteady on her feet. And she did have a severe murmur.
Yeah, she was our one.
Okay.
She was the one.
Yeah. So she had a 6 out of 6 murmur that you could feel through the stethoscope. And I do believe they got sound of it. Mm-hmm. They held up the little microphone to the stethoscope and you could actually hear it. But yeah, hers was so strong that you could just barely touch the outside of the stethoscope and the whole thing would vibrate. On top of her crazy heart murmur, she also had cataracts in both eyes, possibly missing some teeth. She had abnormal proprioception. She did get pain meds while she was down on the trailer before we got her up. Ultimately, she was provided the last act of kindness. That heart murmur was just absolutely insane. And we get blood on all of the horses to send out for Coggins. And when we spun hers down, she basically had no serum. It was just solid red blood cells. So our best guess was that just her pack cell volume was so high that there was nothing to spin out. Like we've never seen that on all the horses.
Her heart disease was so severe that...
Yeah, it was very weird. And we spun it multiple times to see if it would spin out, but it was just a brick of blood cells.
B25 188 was a 7-year-old Tennessee walking horse. She was very sweet, bright, alert, responsive, halter trained. Her heart rate was also in the 70s initially, and after pain medication, it came down to 56, which is still significantly elevated. She did have nasal discharge and increased lung sounds on both sides. Sometimes we don't characterize those lung sounds, but she had evidence of pulmonary disease. She had conjunctivitis in both of her eyes and some discharge coming from both eyes. She had a bloody nose and she had a dropped left shoulder. So her whole left front leg was just kind of like sagging down. And then at the fetlock at that lowest joint, it was just kind of like knuckled over. So my differentials included a fracture and or paralysis of the radial nerve, which is the main nerve that comes through the brachial plexus, kind of like here, basically, in a horse. If you damage this nerve, you lose the ability to lift up and move this leg normally. And I don't know if you can do anything about it in humans, but in dogs, there's nothing that we can do. The only recourse is to amputate the limb. This horse wasn't able to bend her carpus at all. And when we took radiographs, and I have not had our radiologist look at these, so this is me as a GP interpreting the findings, but there was a fracture in her left front leg just distal to the elbow. And in my opinion, the radial nerve was fully damaged and the leg was not functional. And she was given the last act of kindness. One other quick thing, she had strong digital pulses in the right front. So the left front was the dropped shoulder. And a lot of the times in horses, you hear us talk about support limb failure. She was holding almost all of her weight on her right front leg and had been doing so for so long that the right front was experiencing increased inflammation and was starting to fail.
All right, B25 189, 26-year-old paint gelding. It's kind of like a palomino in white color, so he was very beautiful. Super sweet, very easy to work with. Heart rate was 44. For the most part, had a pretty normal exam. Heart, respiration, lymph nodes, oral exam, everything was pretty normal. He did have diarrhea, a little bit of sunburn on his muzzle, but he had, you'll see if you watch the videos, his penis was a mess. It was very ulcerated, and his rectum was actively bleeding. His hooves were actually well maintained, but pretty much his penis and his rectum were the main issue.
They were just covered in masses.
Yeah.
Just ulcerated, bleeding.
Hard, crusty.
Tumors.
We have not done any type of fine needle aspirate yet or histopath. We did save a sample because he was provided the last act of kindness, but we do suspect that it was probably squamous cell carcinoma. So we're going to look at that. He was also missing his right eye. It had been surgically removed, so that wasn't like just trauma and it was sunken in like we get a lot of, but it had actually been completely removed at one point. So somebody had taken care of him at one point, and he just ended up with us, unfortunately, with
so my best guess,
messed up penis.
This side of his face was white. So if I had to guess, I would guess that the squamous cell carcinoma presented in the eye. The owner had it surgically removed, but it had metastasized elsewhere. And so he wasn't able to urinate or defecate without pain.
Yep.
The next horse is B25 190. This was a 27-year-old quarter horse gelding. He was a sorrel with a pink nose, and he had a little star strip snip. And I wrote, super sweet cookie monster. However, he was dull to depressed. His resting heart rate was 80, did come down to 68 after Banamine, but 68 is still severely elevated heart rate. He had a cardiac arrhythmia. So a murmur is, you hear abnormal sounds. An arrhythmia is, instead of a regular beat, you have dropped beats or you have extra beats. He had increased respiratory effort and an increased respiratory rate. He had abnormal gastrointestinal sounds. He was dropping feed. He was quitting. Quitting is a specific term for little balls of hay that kind of get packed in the cheeks. It's an indication that you have pretty severe dental disease. His mandible was locked, so I wasn't able to freely move the maxilla and the mandible. I'm always really careful when I do that, but that's another sign that either you have a mechanical inability to move your teeth, like a really bad point, or it hurts, so you're locking your mouth down. He had a mass in his left eye, and that eye was blind and kind of shrunken. And then he had a large cornea on the right eye. He could still see out of that eye. His left hind leg was swollen. He had actively draining abscesses in his left hind and right hind, with a pretty significant scar in the right hind leg. And he was almost non-weight bearing in the left hind, and then had digital pulses present in the right hind. So again, when we talk about support limb failure, in this case, it was a hind limb. I know we took radiographs on this horse, and I don't remember what we found, but this horse was given the last act of kindness. Age is just a number, but a 27-year-old, this horse was a body condition score of 2 out of 9. So he's extremely emaciated with dental disease, heart abnormality, gastrointestinal abnormality. He needed his eye removed. The mass could possibly have been cancerous. And he was extremely painful to the point that he couldn't walk on his leg.
Mm-hmm. We normally write down everything we find in radiographs when we take it. This buyout was a little bit crazier than we like. So,
but that's on me.
That's not on you. There were a lot of people this time. So
there was
a lot going on.
Different people. So when we had Dr. Gina, we had a veterinarian who could take the diagnostics, interpret them, and rate it on the paper, and a veterinarian doing physical exams. And we just have one vet. So we're kind of like, Nicole would take radiographs, but legally Nicole's not allowed to interpret those radiographs. So that's on me to go back and take and look at them. So we apologize for some incomplete information. That information does exist, and we will be reviewing and documenting. I don't remember off the top of my head what we found in this guy, but it was not good.
Yeah. All right, B25-191 was a beautiful draft cross mare. She's 22, chestnut with a star. She had multiple brands all over her. So some of our staff assumed that she was probably, what do you guys call it? Like a bucking stock horse. She was completely knuckled over on her right front. So just like the little donkey that we had first, that is what her front right looked like. Her hoof was facing backwards. And so, again, she was pretty lame on it. Other than that major deformity, her exam was pretty normal. GI sounds, lymph nodes, respiratory, everything else looked pretty good. She wasn't great on a halter, but we
She did not trust humans.
No, she was very nervous around everybody. With a little sedation, though, she calmed down. She had gotten her pain meds and everything, and
it was osteomyelitis, like severe.
We did radiographs again post-mortem because we didn't want to make her stand on that leg longer than she needed to because it had been a very long time with a lot of pain. And yeah, those x-rays, again, were
inexcusable.
Absolutely horrendous.
Like probably at least a year since that injury happened.
Yeah. So she was provided the last act of kindness.
Oh, this one. B25-192 is a 3-year-old piebald mini mule. He is very spicy. We have him down as a gelding. However, he did not allow me to palpate down there. So we have to confirm whether or not he is still intact. He was very hard to catch and nervous. However, once we caught him, he would eat treats out of your hand and he calmed down to the touch. So one of the things that I try to assess, buyouts are stressful, slaughter auctions are stressful. We don't ever want to make assumptions about a horse's personality in the context of buyout because it's just, there's a lot going on. But it's always a great sign to me, even if an animal's nervous, if they're willing to eat food out of my hand or calm down a little bit when you touch them. So I have high hopes for this little guy. He's very cute.
He's really cute.
He does have nasal discharge. His little 2.5 baby teeth are erupted, but his 3.5 still haven't come out. So we aged him right at 3. He does have slight hoof overgrowth. He's a mini mule. He's probably never seen a farrier, so we'll get him to see a farrier soon. He was sound at the walk and trot. He does have a pretty sizable wound in the left inguinal region, which is like the inside of the left hind leg, that I was not able to clip, scrub, do anything with because it was like up underneath him. But I was able to visually examine it and culture it and start him on some broad spectrum antibiotics. So hopefully that will take care of it. It does look like it's granulating in really nicely, and I would love to provide care. This is one of those cases where if this had been like, I have to be able to touch it, we would have had to put him under general anesthesia. But I saw it again today, so 2 days in a row, and it's not continually bleeding. It actually looks better today in 1 day. So we're hopeful for him. We have a policy where we do not adopt out intact animals, even if it's a mule that can't reproduce, because they can still have those stud behaviors. And we did run some blood work on him. He was pretty significantly dehydrated. And also, hemoconcentration, hematocrit of 65. So, but other than the dehydration, pretty normal.
And just so you know what's coming, we looked at 12 horses the first day, and only one of them that little
Yeah.
mini mule is the only one that made it through the first day. So we have
Day 2 was better.
Stack of not great ones coming up. Yeah. B25 193, a 5-year-old standard bred stallion. He was extremely afraid. Flinches, even just bringing your hand anywhere near him, would turn his hind end towards people. He was observed coughing when he was kind of out in our little waiting stocks. Could barely do an exam on him just because you couldn't touch him. Covered in scars and everything, evidence of a lot of fighting. Appeared to have some atrophy, so like muscle wasting over the left shoulder. Was lame at a 5 out of 6 in that left front. The carpus was angled abnormally in that leg. And so continuation appears hard and firm, but we weren't able to touch it. We wouldn't have been able to provide him with medical care.
But you could tell, even with him, the way he was moving and the angle, that it was fractured.
Yeah. And so he was provided the last act of kindness.
And then post-mortem radiographs confirmed not just a fracture, but also evidence of bone infection and severe arthritis in that leg. So he would have been, his lameness made sense because he was very painful. There's nothing we could have done to correct that fracture.
Do you want me to do it so you don't cry?
No, it's okay. I'm not going to cry. So we got 2 little Appaloosa mares in. One was about 24, 25, and one was about 19. And so B25 194 was the older one. Her body condition score was extremely thin. She was a 2 out of 9. She was halter trained, very nervous, but very sweet. And as soon as you touched her, she really welcomed the stability of having someone there. She walked more easily with someone next to her. She had some diarrhea. She was blind in both eyes with shrunken eyes and some eye pain, redness discharge. She had a bunch of scars and wounds, poor quality hoof coat, overgrown hooves, extremely thin. She had some foamy mucopurulent vaginal discharge. And she looked like she had been used as a brood mare. She had extremely low lymphocytes. She was very, very anemic, severe anemia. Her creatinine kinase, which is usually attributed to muscle damage, was 1,189, so upper end of normal for that parameter is 470. She was in really rough shape, but I really wanted to save her. And we gave her some pain medication and we turned her out into a big quarantine pasture. And she seemed great this morning. I checked on her early this morning. And then this afternoon, she laid down in the field. And I was really happy because I thought she was napping. So one of the things that happens when we get these horses from slaughter auctions is that they're just exhausted. Mm-hmm. They're dehydrated, they're anemic, they haven't had enough to eat, but they're also exhausted. So in this mare's case, she was the better adjusted of these 2 blind horses, and she was helping her friend navigate, even though she couldn't see either. But unfortunately, after laying down and taking a nap, she couldn't get back up. And thankfully, our staff noticed right away. One of our media team came up and was like, hey, you guys need to come down. And we went down and just kind of talked to her and fed her some cookies. And she was done. She showed no interest in trying to get up again. No. She had injured her leg and was bleeding from her attempt to stand. And it was like she was like, I'm safe and I have sunshine and I'm just gonna go. So we let her go. It was a really, really tough one, but I'm thankful that she was here and that she had some love.
Yeah. B25 195 is the other little blind Appaloosa. She was a little bit younger, about 19, severely emaciated.
Yeah, even
1 out of
skinnier.
9. Yeah, she was just bones. She was not as calm. She was very scared. Anytime you tried to touch her, she instantly would kick out. Even in the chute system we have and everything, just very, very afraid. And had mucopurulent nasal discharge. She was dropping her food. blind in both eyes, covered in scars, especially on her face. So you could tell she was probably running into a lot of stuff. At one point, we noticed she had nystagmus, so the eyes were just going back and forth. And she also had an ulcerated mass on her vulva. So we had provided her with the last act of kindness on that first day just because of how fearful she was and just how she was not adjusted to being blind, even though you could tell she'd been blind for a very long time.
B25-196 was a 26-year-old Tennessee walking horse gelding. He was also extremely thin. I didn't write his body condition score down or any of his stuff. I did a terrible job documenting this horse. I'm really sorry. But I remember, so this horse was another, this was another active founder.
Yes.
So his resting heart rate initially was 80, and it did come down to 48 after pain meds. So that's a pretty strong response to pain medication. 48 is still elevated, but it's much improved. He had a big tumor on the side of his right abdomen. I have no idea what kind of tumor it was, but there's certain criteria that we use to gauge whether a mass is concerning or not. So this one was pigmented, which is not a good sign. It was firm. It was tightly adhered to the tissue underneath it, and it was irregular. So all of those things tend to be attributes of a malignant tumor versus a benign tumor. But again, the tumor was like not our biggest concern. Yeah. This horse was extremely lame on the right front leg. None of this is written on this page. I should have gone through this. So he was very, very lame on the right front leg. He had active bounding digital pulses in both front feet. And when we took radiographs, we had severe rotation and active end stage founder where we had sinking and rotation. So normally, here's your hoof, here's your coffin bone. It should be nice and parallel. And when founder happens, you have rotation, but you also can have sinking. So this horse had both rotation and sinking. And on the radiograph, there was like a millimeter of hoof between the end of the coffin bone and the outside of the horse's body.
I think wasn't he the one we were like hoping, we were just like, maybe it's just an abscess.
Yeah.
And then we took the images and we were like,
there were 3 in this group, and he was one of them.
Yeah, there were quite a few of them.
Yeah.
B25-197, a 23-year-old paint gelding. He's brown and white. He had a lot of increased respiratory noises.
I know.
And fatty deposits along his neck. We did wonder if maybe he had Cushing's, but his test that we did came back pretty in normal ranges. So his submandibular lymph nodes were really enlarged. He had a huge abscessed area under his chin. His GI sounds were completely absent. He was blind in both eyes. And we gave him some sedation, and it actually increased his respiration up into the 80s. So he was pretty much in respiratory distress when he came in, and then the sedation kind of elevated that.
Normal respiratory rate is like 18 to 24. Yeah. So his resting respiratory rate was 60. So he was already panting.
Yeah.
And I gave him a tiny bit of sedation.
Yeah, and we had done the sedation so we could get head rads of him to look at that mass, see if he had chondroids in his guttural pouches, and kind of see what was going on. And there were some areas that looked really abnormal in terms of either fluid or gas in, I don't even know, where was it? It was past. So the radiographs, I thought it was air. Yeah.
But in hindsight, after examining the abscess, I think it was fluid. I think it was packed abscess fluid. So this horse had such big swelling here that there were pockets of fluid up by his second cervical vertebrae.
Yeah.
So like ears, neck. So his whole throat had swelling and infection that was packed up and creating pressure. Yeah. We did take samples so we can confirm what that was. but he was in extremely bad shape. And then the absent GI sounds is like a totally different disease process from.
Yeah. If it had just been the abscess, we would assume it's probably strangles. We would have tried to get him through that and seen what happened. But being in respiratory distress basically from when he arrived and it just getting worse, we did provide him with the last act of kindness.
Super sweet boy.
Yeah.
B25-198 is a 1-year-old little quarter horse filly. It's so hard to have to assign breed to babies. I have no idea. We have to for their Coggins paperwork. So we say it's a quarter horse. We have no idea. She's very cute. She's thin. Her body condition score is 3 out of 9. She is quiet, but dull and depressed. She's halter trained and easy to catch and very sweet. She does not feel well. She doesn't have a fever. Her heart rate and respiratory rate were normal, and she doesn't have a murmur or any other abnormalities on listening to her heart. She has crusty nasal discharge, but no increased lung sounds. Her lymph nodes were normal. She had redness and discharge of her eyes, but I wrote consistent with dehydration or irritation. So she didn't look like she actually had conjunctivitis. She had scars kind of all over her body, mild hoof overgrowth, very poor musculature, no obvious lameness. And her blood work showed pretty significant anemia. And really anemia, dehydration, some low protein. So protein loss can occur, or she could have not been getting adequate nutrition. I am really worried about her. We aged her at 1. I think she's less than 1. So we did vaccinate her and deworm her, and hopefully those vaccines will help protect her from getting sick again. But we know she just got exposed to pathogen soup at a slaughter auction. So
for her exam being so normal, she looks like she feels
terrible. She's just standing like, ooh.
Yeah. B25-199, a saddlebred gelding.
This is the liver chestnut that we looked at today.
Liver chestnut, very skinny, 2 out of 9. Halter broken, was very bright, alert, and responsive, very sweet, very respectful. He was a cribber. Pretty normal exam as far as heart, lungs sounded good, lymph nodes were normal. Did have increased GI sounds. Oral exam was good. Eye exam was good. But he had abscesses in 3 out of 4 feet that either had recently blown out or actively were still draining. Really poor body condition score and muscle condition. He was lame in both the right front and the right hind. And then his proprioception was really off. He's the one we did the back x-rays.
Yes, he's the one with that crazy, weird
x-rays on his back because he did have pain on palpation of his back. And at first everything looked normal. And then I'm going to let you
Sure. So in
sort
his,
of explain what we might be.
In his sacroiliac region, so you have cervical, thoracic, lumbar, and then sacroiliac is kind of
The hip area.
The hip area, but like the point of the hip. I have never seen a radiograph with these findings. I don't know how to accurately interpret them. I did cheat and send them to our Dr. Marina via text message, and they were very abnormal. To the best of my ability interpreting it, it looks like there had been a spinal fracture that healed with bones being adhered to other bones where they should not be.
Mm-hmm. Yeah, so it wasn't just bones touching. It's just a solid bridge of
but like bones that should not be connected to each other. And then the proprioception was very abnormal. So this horse wouldn't just drag his hind leg. He would stand with his pelvic limbs just kind of like out at weird angles. Mm-hmm. And so I really struggled initially because usually the neurologic disease. So proprioception means, does your brain know where your legs are in space? So his brain didn't really know where especially his hind legs, but his front legs too, he was a little weird and draggy. And so Dr. Marina said, we need to know what's going on more in the other parts of the spine, which she's exactly right. A horse like this, we needed like a spinal CT to look at the spinal cord itself, because I suspect if we had a fractured back, then we had issues with the nerves going to those pelvic limbs. But either way, heartbreaking. This horse was gorgeous and young, but he was very painful and very, I don't know what to say about that back. But we're going to have our radiologist review it, if for no other reason than that we can learn exactly what we think happened there, so we can learn for the next cases.
It can be really hard because we're having to make a decision based on what we're assuming is or isn't painful sometimes, because animals can't tell us they're in pain. So unless it is very obvious, we have to take an educated guess on, did you break your back and now you have severe pain in your back that we just don't know about. So you kind of have to balance that prolonging suffering versus let's do a ton of diagnostics and see if maybe it's okay, and then you spend weeks with this animal suffering and you have no idea.
But on the flip side too, there are extremely treatable conditions that cause very high levels of pain. We have a horse in our hospital right now that had an abscess, and the 2 days before that abscess ruptured, her heart rate was in the 70s, even on pain medication. That's how badly that abscess hurt. So we don't ever want to give up on a horse that has a treatable problem, and we don't ever want to assume. It's just tough. There's a lot of discussion, and I'm so thankful for our team, but honestly, it's easy. The ones where you're like, that is a completely broken leg, those ones are a little bit easier for our team because we never, ever, ever want to give up too early on a horse. But this poor guy, he was lame in 3 out of his 4 legs, and so it was really hard to assess because he was so uncomfortable that he just kind of tottered around on his legs. B25-200 that's the 200th buyout horse Horse Plus has had in 2025. Is a 1-year-old filly. We called her a quarter horse. We really have no idea. She doesn't look gaited. She's a little chestnut with a stocking on her left hind and a blaze. She's extremely thin. She also is lethargic, dull, depressed, quiet. Halter trained, very sweet. She has wheezes in both of her lungs. She has nasal discharge. She's got a little bit of enlarged submandibular lymph nodes, which is not great. All baby teeth, conjunctivitis, poor quality hair coat, hoof overgrowth, very poor body and muscle condition scores. Sound at the walk. Her blood work shows dehydration, low protein, and anemia. So actually very similar to our other little chestnut baby who's just not feeling great.
B25-201, a standard bred gelding who is 17. 3 out of 9 body conditions, so again, very skinny. Halter broken, bright, alert, and responsive. His right hind leg was really swollen and had pitting edema on it. Heart rate was 40, respiratory rate 18. Did have a 3 out of 6 heart murmur. No increased lung sounds, lymph nodes were normal. Increased GI sounds though. His mandible was locked in place. Eyes and skin were pretty normal. Did have mild digital pulses in the left front. Decreased muscle mass and body condition. Again, pain on palpation of the lumbar spine. And then severe lameness in the right front, about a 5 out of 6. And he also had delayed proprioception placing in the left and right hind. We did do radiographs of him. He had received pain meds yesterday and today. And he had a ton of arthritis in his SI joint. And so he was provided the last act of kindness.
And this one his proprioception was much worse. Like when I led him over a bar on the ground that was this high off the ground, he tripped on it with both of his front feet. So his issues were worse from a central nervous system standpoint than the other guys. B25202 is a 20-year-old quarter horse gelding. He is also extremely thin, super sweet boy. He's a chestnut with a blaze and socks in the front, stockings in the hind. He is quiet, alert, responsive. He has been coughing a good bit, but no temperature. He has mucopurulent nasal discharge, which is that like yellowy, thick kind of banana pudding. We sent a sample of that off. He has diarrhea. He has conjunctivitis. He was dehydrated. And then his blood work shows signs of an infection. So we pulled this blood this morning.
Yes.
So this horse will need antibiotics, but we haven't given it to him yet because we literally ran this blood work like 20 minutes before we sat down with you. So he has pretty strong indications that he has an infection somewhere. He is dehydrated, and he's got some high globulins. That's probably related to dehydration. So he's a really sweet boy. I don't actually know where his infection is. I'm guessing it's in his lungs. Mm-hmm. So we'll just have to do supportive care and get him through that, hopefully.
B25203 is a 1-year-old gelding. Again, we're assuming quarter horse. We're not completely sure. He's a little bay with a star. He is hard to catch, but once you do catch him, he is halter broken. Very high alert, kind of nervous. Curious though, and when you start touching him, he calms down, which is nice. Heart rate at 24, respiration was 18, heart sounded good, little bit of nasal discharge, but the lung sounds were normal. No swollen lymph nodes, little bit of increased GI, and eyes and oral exam are good. His right hind leg is swollen. We've got a puncture over the dorsal fetlock and the lateral fetlock, and then the dorsal coronet. So we've got like 2 spots. And we clipped, cleaned, scrubbed it out really good. With a little bit of sedation, he was, right, because he's the one that had to sedate him a little bit, because he wasn't loving the original touching of that leg. And he was more reactive to the
He hated the
lower
clippers.
one.
The clippers were also scary on his legs.
Yeah.
So, we didn't do a lot of clipping.
Yep. We did do some x-rays of that leg, and there is a little bit of bony reactivity associated with those wounds, it looks like. We are really hoping it doesn't communicate with the joint. Mm-hmm. So he is one we're going to try and get some contrast that we can inject in there and see if it is communicating with the joint. Otherwise, if it's not, we're hopeful that that'll just heal up and he'll be good to go. So he is out hanging out in his pasture.
He is. So his leg looks awful, but he seems to be really comfortable on it. And that is what gives me hope more than anything else. He'll walk and trot around. So the x-rays, those puncture wounds they're very deep. Yep. But we're hopeful. And we did start him on antibiotics.
Yes.
The sweet old ones, they just kill me. B25204 was a 26-year-old, I called him an Arabian cross. His face kind of looked like a Hackney pony. He was a little big for a Hackney and a little small for an Arabian. Super sweet. Body condition score of 1 out of 9. That is the lowest BCS you can assign a horse. He was extremely sweet and halter trained, like actively solicited your attention. He showed no interest in hay. And we fed him a big, soft bran mash, and he tried to eat it, and it just fell right back out of his. He'd consumed none of it. He did have a 4 out of 6 heart murmur on the left side, and he did get pain medication. He had some nasal discharge. He had some diarrhea. We took dental radiographs, and I have all caps, severe dental disease. I don't know if you guys watched the BUYOUT from, I think, the month before last. Mm-hmm. I saw the worst dental pathology I had ever seen. This horse's teeth look just like that. So we should have 2 occlusal surfaces that look like this, top and bottom, and his were like this. but the bottom teeth were so overgrown that they were like a full centimeter up into the gums and the roof of the mouth. And this he literally could not eat with open sores in his mouth.
Well, in that one arcade, he was missing a bunch of teeth too.
They were fractured.
Yeah.
So on the other side, missing teeth to me is like sometimes they're fine.
Yeah.
This guy's teeth were slab fractured in half. So he had to have been in incredible pain. He literally couldn't eat anything. And there was nothing I could have done. Like I couldn't have even pulled all of his teeth to get him comfortable. He also had hypermature cataracts. He was a really good boy.
Mm-hmm. B25205 is a 1-year-old quarter horse, we believe, colt. He, again, would not let Dr. Lydia palpate up in there to see if he had his testicles or not. We could not see any. And he was bright and alert, halter broken once we caught him. Another one where once you started touching on him, he calmed down. Temp was 100.1, so that's normal. Heart rate of 44, respiratory rate of 24. Slight increase in lung sounds, more on the left side than the right, and he was coughing on and off a little bit. Lymph nodes were not enlarged, but they did feel a little bit scarred or fibrotic. Increased GI sounds. Is he the...
He's the carpal valgus.
Okay. Mm-hmm. So we just had circled deformities under hooves. So his front legs come in and then go back out at the carpus. So his carpi just touch. He's real cute.
Kind of all the time, whether he's walking or standing,
yeah,
they touch.
But it's very abnormal. So we're going to see how he does. He is out there hanging out with his buddies that he came with, but we'll just kind of have to watch him and see if that abnormality in his front legs is going to cause any problems for him.
And notably, it's usually congenital, and it's not believed to be a painful condition, at least not right now. That doesn't mean it couldn't develop into more concerning problems later on, but we're not kicking a ouchie baby out. Yeah. He seemed pretty comfortable.
He had a pretty normal CBC for his blood work. His white blood cells are trending either into infection or out of infection. He's like right on the edge. So we'll keep an eye on him.
Getting over strangles.
Yeah.
Our last B number is B25206. He is about 2 years old, and he is intact. He's a little colt, little stud colt. Again, we called him quarter horse. No idea if that's accurate or not. He was a little better in the weight category than some of the other babies, so he was a 3 out of 9, still too thin. He's a little chestnut with a blaze and 4 stockings, and he was very reactive and nervous and kind of high alert, but he would take treats out of my hand once he was in our chute, and he didn't show evidence that he was halter trained. So one of the things that we can do once we put a halter on is, if they've had any halter training, they kind of yield to pressure. So you can put a little bit of gentle pressure, over the noseband, either forward or back. And if they've had any degree of halter training, most horses will yield to that pressure. And this guy was like, what is happening? So he didn't seem like anybody had worked with him. His heart rate was 56. However, he was very nervous. So, and he is one that we weren't able to catch, so we ran him through our chute system. So I attributed his respiratory rate was a little high. It was 28. But again, he was nervous and he wasn't sedated. So I don't attribute that to pain. I attribute that to nervousness. No fever. His temperature was 99.1. He does have increased lung sounds, a lot of nasal discharge, really crusty and gross. He had enlarged submandibular lymph nodes. This was the one. So this guy actually was a great teaching opportunity for us. We actually had to put him in we have a padded squeeze chute that lets us access parts of the body without sedation if we need to. It's designed for Mustang. So this little guy would not let me look in his mouth. So we squeezed him in our padding so I could look in his mouth, and he was about to lose both of his baby teeth on his first incisors. So we got to actually see those caps. It was a very healthy, normal. So he's right at 2.5, although for our Coggins paperwork, we have to pick a year. We can't do 2.5. So we aged him at 2. He has tons of scars, which to me looked like fighting. They looked like kicks and bites. So, and he did have at least one testicle. I don't think he's a cryptorchid. I just couldn't safely palpate more than one. And we just, if there's a testicle there, there's testosterone. So he was sound at the walk. So I just kind of jotted down concerns. Okay, so we had a kind of a discussion about this guy because of the babies in our group, he is the most obvious that looks like could be blowing strangles, which is a bacterial disease, strep equi. He has all the hallmark signs except for a fever, but that fever can kind of be transient. So we didn't want to keep him with the other babies. His behavior with the other babies, he was bullying and pinning his ears and kind of biting and, acting like a little stud colt. He also needs to be castrated. His feet were super overgrown. So he's on a needs to see the farrier stat, but he won't let you catch him. So he needs to be castrated, but he's sick. And his immune system already is fighting off stuff. I ran blood work on him today, and he's got 2 pretty significant abnormalities. His AST was elevated. So AST can be indicative of either liver disease or muscle damage, but he had another indicator of liver dysfunction. So why a 2-year-old has a problem with his liver, I don't know, but that is concerning. And his complete blood count, his CBC was pretty normal. He wasn't even dehydrated. So we're going to keep a really close eye on him. We did put him in a quarantine pasture away from others by himself. And in 2 to 3 weeks, we're going to recheck him, blood work, temperature. If he's a good candidate for surgery at that point, we'll try to schedule his castration for a time when our farrier can also do his feet while he's asleep on the ground. But we have to put that castration on hold until he's healthy enough to undergo anesthesia. And that was the last one.
And that's it.
If you stuck with us through this, thank you for your support. This is a really difficult job, and it's only possible because we have people who support what we do. We have a lot of people criticize this organization and say, why aren't you saving horses that are savable? And I would argue as a veterinarian that every horse deserves someone to care about them and tell their story and give them a voice, especially when they've undergone abuse. Every horse deserves comfort and dignity and a peaceful passing. And that's a huge part of what we do here at Horse Plus. And it is extremely emotionally taxing, but it's also very rewarding to take animals that have been suffering, sometimes for years and years, and alleviate that suffering. So we love the happy stories. We love it when people retire their horses with us that they can't care for anymore. But these buyout horses.
Yeah. They're usually in pretty rough shape.
Yeah.
Thank you for watching.